Good morning or afternoon. For my entry, I would like to talk about the potential impact of starting a self-sustaining, replicating eye care center in developing countries. My name is John Kempen, and I think most of you know me. Blindness is a global public health problem. There's in the range of 285 million people worldwide with reduced vision, and around 40 million, recent estimates maybe a little bit less, who are blind. And the highest age-specific burden of blindness per capita is in sub-Saharan Africa. If we look at what causes these problems, we can see that most of the problems require management by a specifically trained or individual level management by a well-trained clinician. And so therefore, retaining clinicians and training them are a high priority. This is quite different from other aspects of global health, where things can be done by a low-level person at a village level. High-quality services are what make an organization sustainable and accomplish the goals of rehabilitating the blind and preventing blindness by clinical management of disease. A high-quality service provides a foundation also for training and research and a foundation for public health outreach work, as well as ministry kinds of outreach work. And so first, we have to give attention to setting up excellent clinical services. This shows the effect of this kind of approach in India. There was also a World Bank program during this time to fund cataract surgery. But as we see that cross-subsidizing services were implemented by Aravind, LV Prasad, Shankara Nathrali, and others, we see that the number of cataract operations per million population in India greatly increased over a period of only about 15 to 20 years. And this is what we would like to see happen in Africa as well, with a desirable cataract surgery rate of about 3,000 to 5,000 per million population. To do this, we need to do a lot of training as well. And so as the model I'm proposing will set up, it's ideal for providing training. Now, for a standard public health program, we begin with a foundation in peripheral areas. And this is a model that the LV Prasad Eye Institute put together. But really, the foundation is the center of excellence at the top, and everything proceeds out from that and is a foundation, and it provides a foundation for all the work. And so starting a center of excellence really is a foundational strategy towards developing things. Now, I did some simulations about what would happen if one began a center and made certain assumptions about its growth. So say that you start a center and it does 750 cataracts the first year, which we're discovering is a little bit difficult. But if you start at this level and then you increase by 15% per year or 10% per year, you end up with hundreds of thousands of surgeries happening by the time you get out to 49 years. If you increase in this volume and you start new centers that do the same thing about every 7 years. And so starting a center and proliferating it can have a large impact. If we look at the number of times to start it, or the amount of time to start a new center, we can see that it has a little bit of a change on the profile, and that the rate of increase in surgical volume is really the most important driver. It's equivalent to both doubling the initial surgical volume and decreasing the generation time of developing a new center to 5 years. So in practice, the rate of increase in surgical volume will actually be related, though, to the generation time. And so trying to rapidly develop a self-sustaining approach to increasing surgical volume is really foundational. Since most blindness requires individual level treatment, a cross-subsidizing, self-sustaining eye care center provides a channel to address the problem, which is currently not available in nearly anywhere in Africa, which, as I demonstrated over time, could alleviate visual impairment and blindness in a big way. It's ideal for training and establishes a desirable professional paradigm for practitioners wherein they could work to avoid brain drain. It's also ideal as a research platform for fundraising and for influencing policy. More attention needs to be given to the development of such institutes by the blindness alleviation community. In my mind, it's an attractive investment for capital that's intended to alleviate blindness. I think of it like a venture capital kind of thing where the benefit of the capital investment is intended to benefit the poor. That if you started several centers like this, you would have a huge impact potentially over the years on blindness alleviation. It's also a possible new approach to the Link movement, and there are pioneering centers in India that are available to provide guidance. Thank you very much.